Hello everyone. Are you an adult male whose age is more than 50 years? Do you have to get up in night again and again to pass urine? If that is the case, then you must see this video. In this video, I am going to explain to you why does it happen. Friends, one of the very common reason which I call is situation 1 is that your kidneys are producing more urine during the night time. You may ask me a genuine question, sir, why does this happen? Why should my kidneys produce more urine during night? Then there are many reasons for this. One of the very common reason is that you habitually consume more liquid just prior to falling asleep. In our country, it is a very common practice that elderly males take milk at bedtime, or they have to take lots of medicines at bedtime, for which they take water along with the medicines. Some males consume alcoholic drinks. So obviously, if you consume more liquid before going to sleep, your kidneys will produce more urine during night. Another situation may be that you had some cardiac problem or shortness of breath or some swelling on the body, for which you went to the doctor, and doctor has advised you a medicine which we call diuretic. Diuretic tablets are usually given in the morning, but if by mistake you start taking this in the evening hours or just prior to sleeping, then obviously under the influence of this medicine, your kidneys will produce more urine. Third thing, which is also very common, that if you have diabetes and if your diabetes is not appropriately controlled, your kidneys will produce more urine in night. Then there are some people who have some swelling of their feet, either because of some liver disease or because of heart disease or because of respiratory disease, thyroid disease, many diseases. There's some swelling in the lower limbs in the daytime, and when you go to sleep, you lie down straight, flat, then whatever fluid has accumulated in the lower limbs will move back in your body, and the kidneys will have no option but to eliminate this extra fluid from your body. That's why they will produce more urine in the night. And then another problem where elderly people snore whole lot while in the deep sleep, and some of them may be having sleep apnea syndrome. This will also result in excess urine production by your kidneys. The second situation, my friends, is that your kidneys are not producing excessive urine, but whatever urine they are producing, it is coming to the urinary bladder to be stored there. But unfortunately, urinary bladder is not capable of holding that urine for sufficient duration of time. And this happens because of a very common problem which we call as overactive bladder. And in this condition, the muscles of urinary bladder all of a sudden contract. You must appreciate here one thing, that the muscles of urinary bladder are such that they relax more and more to accommodate more and more urine inside the urinary bladder. Suppose bladder has 100 ml urine, there is some tone in the muscle. If urinary bladder has to accumulate 200 cc, 300 cc, 400 cc, then urinary bladder muscle has to go on relaxing and relaxing. This is called stable bladder, normal bladder, compliant bladder. But if there is some problem in the urinary bladder muscle, because of which it suddenly starts to contract instead of relaxing, then the urine which is present in the bladder tends to go out. This is called overactive bladder. The second situation is that the muscles of urinary bladder have another problem, and they are not able to empty the bladder fully. It is called incomplete emptying of urinary bladder, and because bladder is half emptied, half is left inside, next time when the patient will go to toilet, he will take less time in filling up the bladder. So this will manifest as frequency during the night, what we call as nocturia, and that is what we are discussing. So if you want to learn from me, why is there an overactive bladder or why is there incomplete of urinary bladder, let me first explain to you in simple terms what is this overactive bladder and why should there be sudden onset uncontrollable contractions taking place in the wall of urinary bladder. So first condition is called overactive bladder, and as you can see in this picture, there are lots of arrows shown towards the center of the urinary bladder. This means that the muscles of urinary bladder, instead of relaxing, contract all of a sudden and they generate a pressure. In some people, they generate so much of pressure that urine suddenly leaks out, and this condition is called urge incontinence. Second reason for uncontrollable contractions in the wall of urinary bladder is that you have one or some kind of a neurological disease. Commonest cause is Parkinsonism, or you have had in the past what is known as stroke, one half of the body got paralyzed, or dementia, or rarely a brain tumor. So some such kind of neurological disease can also influence functioning of urinary bladder wall. Third situation, which can be really serious, is some patients start developing a cancer in the urinary bladder or a stone in the urinary bladder, or they have chronically ongoing urinary tract infection inside. So because of all these things, bladder muscles are not normal, they keep contracting as and when. And fourth situation is probably the commonest for your age, the elderly males, that is some kind of a enlargement of the prostate, which is known as benign prostate enlargement. In some patients, this prostate gets infected and the disease is called as prostatitis. You may even develop some small abscess in the prostate gland. The second reason is that bladder muscles are not capable of fully emptying the urinary bladder. We call this as partial emptying of urinary bladder, and as you can see here, this is full bladder and this is bladder half emptied. Half bladder will take less time to fill up. This happens because of either an obstructive disease taking place at the outlet of urinary bladder, like prostate enlargement or stricture in urethra or stone in the urethra, or else the muscle of the urinary bladder wall is paralyzed or underactive, or you may say having less contractile force because of a neurological disease or some medication which relaxes bladder wall, or in elderly people more than 80 years of age, this can happen without any reason. Just because of senile changes in the body, muscles of the bladder wall becoming weak, because of which patient is not able to empty the full urinary bladder, and therefore he keeps going to toilet again and again. The third situation, friends, is also very common, and this is that you are not able to have sound sleep in the night. And if you are not sleeping well, what else will you do in the night except visiting toilet again and again? So if you want to ask me in summary that I am an elderly male and I am going to toilet in the night very often, I have to get up very often, what are the reasons? First situation is your kidneys are producing excessive urine in the night, or the second situation is the urinary output is normal but urinary bladder is not capable of holding the urine, that's why in the night you go again and again. Third situation is that there is some kind of a sleep disorder, you remain awake in the night and that's why you visit toilet more often. And fourth situation can be that you have a combination of all these three in various degrees. So friends, I hope you have understood from me that what may be the reason for you have to go to toilet again and again in the night. And if you have such a problem, it will be better to consult a capable urologist and get yourself fully diagnosed as to what is happening to you and get timely, proper treatment. Thank you very much.